Dear friends, welcome back. In this video lesson, we shall be looking at an emergency medicine case of acute appendicitis, which was cured with Belladonna. It's a very interesting case, and it just goes to show how homeopathy can be useful in acute emergency cases. You must remove from your mind the impression that homeopathy is only for slow-acting cases, slow-acting remedies, and that it is good for chronic cases only. As you'll see, this is a emergency medicine case. This case has been taken from the book which I have referred to earlier in the chapter on aconite, and the title of the book is Homeopathy in Intensive Care and Emergency Medicine, and it is an anthology or a collection of 145 cases from intensive care and emergency medicine, and it is edited by two doctors, Martin Bundner and Michael Frass. This particular case is from the files of Martin Bundner, and it appears as case number 12.2-9 on page 336 in this particular book. A word about the appendix. As most of you know, appendix is actually an appendage which is located at a point which is at the junction of the small intestine and the large intestine. You can read more about this in books on anatomy and physiology, or you can attend a lecture on Khan Academy. One way to locate this on the physical external anatomy of a person is to first locate the umbilicus, shown as point number 2, and then locate point number 3, which is also known as the anterior superior iliac spine. So if you have an imaginary line joining point 2 and point 3, that is the umbilicus and the anterior superior iliac spine, then 2/3 of the distance from the umbilicus or 1/3 of the distance from the anterior superior iliac spine is a point which is known as, or which is called as, the McBurney's point. So as a physician, you will have to palpate that particular point, and the patient will report sensitivity and pain. So that is a fairly good sign that there is some inflammation to the parts underneath, and most likely it is the appendix. We'll take a further look at the location that we mentioned earlier of the McBurney's point. First, to locate the anterior superior iliac spine, this is a wonderful diagram, and this is where it is located. You can physically feel the bone. And as we said earlier, if you join the line from this point to the umbilicus, then 1/3 of the distance on that line from the anterior superior iliac spine, or 2/3 of the distance from the umbilicus, is where the McBurney's point is located. We'll now take a look at the symptoms reported by the patient. She was a 15-year-old girl with a severe abdominal pain. The abdomen was soft and the area around the McBurney's point was very painful. Her body was hot and she reported feeling feverish. The pain was worse standing or walking. She felt better lying down or bending forward. She had nausea, but there was no vomiting. And the last stool that was passed was in the morning, and that was perfectly normal. No abnormality was reported in the bowel movement. Now for the diagnosis. The hemoglobin levels were at 12.8 grams per deciliter. Leukocyte count was 20.3 per nanoliter. And the difference between the rectal and the axillary, that means in the armpit, the temperature difference was more than 1 degree Celsius. So based on these 3 points, the doctors diagnosed it as a case of acute appendicitis. Mind you, there was no sonography or ultrasound test done in order to determine the condition of the appendix. Continuing further, if we look at appendicitis in homeopathic software such as radar, we will find that the top remedy for this particular condition is bryonia. And among the top 5 remedies, we have got Roostox, Lachesis, Belladonna, and Plum Balm. So bryonia happens to be the top remedy for appendicitis, and Belladonna is somewhere on the 4th ranking. Now we shall do a repertorial analysis based on the symptoms presented by the patient. So the first symptom taken by the doctors is that there was pain in the abdomen and walking aggravated that. Also, there's an aggravation by standing. Lying down on the abdomen makes the person feel better. And there was another amelioration, which is when the person or the patient bent forward, she reported feeling better. So walking and standing aggravates, and she feels better lying on the abdomen or bending forward. If we look at the results, we find that Belladonna is the leader with 13 points and covering all the 4 rubrics. And this is followed by cholesynthesis, Calcarea carbonica, sepia, aloe, and bryonia. Bryonia happens to have the number 6 ranking over here. Or you can say it's the 3rd highest remedy, because if you go by for the 4th highest remedy at 10 points. Let us take a look at Materia Medica Pura by Samuel Hahnemann in order to determine which remedy fits best. The doctors had chosen Belladonna on the basis of the fact that Samuel Hahnemann mentions ineffectual effort to vomit, empty, retching. Cannot vomit, irritability of the stomach. Now these are all symptoms from provings. Bellyache as from hard weight, only on standing and walking. Contractive pain, must bend forward on account of the pain. So the prescription was 10 drops of Belladonna in Q6 potencies. So Q stands for the LM potencies. We shall be talking more about that in a separate module, and that was to be repeated several times. The progress of this child's condition is now noted below. The patient was referred to surgery, but the girl was unwilling to undergo surgery. She refused to go to the surgeon or the surgical ward. The parents were uncertain and they decided to wait for the time being. 2 hours later, she was no longer feverish. So they decided to wait and watch, because apparently the pain was also more tolerable. At 8 p.m., which is 1.5 hours after the 2 hours had passed, the temperature once again rose to 37.9 degrees Celsius. So she took another 10 drops of Belladonna Q6, and by 10 p.m. the temperature had dropped to 37.1. The patient was seen the next morning by the same doctor, and when they tested the blood, they found that the leukocytes had dropped to 5.7. Hemoglobin was at 12.9, and once again she was given 10 drops of Belladonna Q6. After that, wait and watch. 4 days later, the patient reported that there were no symptoms, hence there were no more doses to be taken, and there was no surgery This is a very interesting case because this is a case where a person who was admitted to the ER room or the emergency ward was able to avoid surgical intervention just with doses of belladonna. Remarkable recovery, remarkable analysis, and a remarkable result. So that brings us to the end of this presentation. Thank you very much for your attention. And if you have any comments, observations, or you wish to share experiences, please post them on the discussion forum. So until we meet again, thank you and bye-bye.